Good afternoon, everyone. Glad to be back here again with a new topic. We're going to cover a very important topic of rounding, and I'm glad that so many of you have joined today. So, without further delay, let's get into the topic. I'll talk a little bit about rounds, that is the introduction, then get into the purposeful rounding, which will take majority of the time today. And then we'll also look at other strategies which will actually increase the effectiveness of your rounds, that is using whiteboard and using the 5 bedside safety checks. Now, rounds, as you all know, is a scheduled visit made by the nurses to the patients in their at the bedside in the hospitals or other healthcare setting. Other healthcare setting means nursing homes and things like that. Rounds happen. So the purpose of rounds, there are many, but basically we are focusing on patient care. Whenever you do rounds, you are only looking basically at patient care and patient safety. These are the two main things which we focus when you do rounds. And the objectives of nursing rounds are patient monitoring and safety. Effective communication is very important. And what are the importance? Why is round so important? Because it helps in patient assessment and care. It identifies changes in patient condition. It gives you time to do medication administration and also communicate with the patient. And also, whenever the patient has new complaints or any concerns, you're able to address it when you do the rounds. And finally, collaboration. You will do rounds with the doctor or with the dietitian or with many other healthcare team members. So, in a multidisciplinary team, the rounds help to enhance the communication and enhance the care of the patient. Now, what are the best practice of doing nursing rounds? We can call this 4 Ps. The first is to prepare. So before the rounds, you need to review the patient chart, any recent test results, care plans, doctor's orders, and make sure that you are not coming back and forth. So you prepare, decide what is to be done for the patient, and then start the rounds. The second is prioritize. So which of the patients you got to round first, you'll based on their acuity, that is the serious illness of the patient and the needs. The third P is patient and family engagement. So during the rounds, you not only involve the patient, but also the families in the discussion about the care plans. And finally, paperwork. You need to document at the bedside. That is ideal. But if you don't have the place or time, then it should be documented as soon as possible. So these are the 4 Ps of best practices for conducting nursing rounds. Now, how can we measure the effectiveness of the nursing rounds? Unfortunately, there are no direct measurements which can tell you the effectiveness of the nursing rounds. So we need to look at proxy measurements, indirect measurements, which will tell you indirectly that the nursing rounds was effective. Now, what are these measures? So these are some examples. So any patient improvement in outcome in improvement is due to the nursing rounds. Though many other factors are involved, you can take that as one of the indirect measurements. Reduction in hospital stay, any medical errors and adverse events, and reduced call bell use. If you do the rounds efficiently, as we will look into in the next part of my talk, it will reduce the call bell use, lead to patient satisfaction and engagement. Very importantly, it leads to nursing satisfaction and their engagement in the rounds. So you could measure all of these or any one of these and use it as a proxy, that is an indirect measurement of rounds. So you can't tell 100% it is because of the rounds, but all of them put together is the net effect of doing an efficient rounds. Now, this is what was promised in the webinar announcement. The 3 strategies to improve the effectiveness of nursing rounds. So one is what is known as purposeful rounding. The second is using a whiteboard in the patient's room. And the third is doing the 5 bedside safety checks. These are the 5 essential bedside safety checks. You will do many others. But even if you don't do the others, if you do these 5 bedside safety checks, majority of the errors will come down. So this is the 80-20 rule, not doing a little bit to make sure that you achieve a lot. So first, let us look at purposeful rounding. Now, what is purposeful rounding? This is a proactive approach to rounding, and it is nurse driven. So it's not going along with the doctor or anything like that. It is basically the nursing team which does this rounds. It is an evidence based. There are several papers in the literature which tell that purposeful rounding, when implemented in hospitals, leads to better patient outcomes. There's no doubt about that. So it is evidence based and it anticipates patient needs. So most of the time, the rounds will happen when the patient rings the call bell and you will go. So that is, the reactive way of doing rounds or visiting the patient, where here you anticipate the patient needs and it is very systematic and scheduled. So you schedule that every hour you will be rounding or every other hour you will be rounding. So this is, scheduled and systematic. And there is a checklist which you will take and do it. So there are so many things to purposeful rounding. That is why I have taken majority of the time to explain all the components of purposeful rounding. Now, how is it different from traditional rounding? If you look at traditional rounding, it is ad hoc and reactive, that is responding to the patient needs as and when they arise. There is no proper schedule, and therefore, you do whenever it as quickly as possible or whenever it is necessary. The frequency of the traditional rounds is variable based on the nurse's workload and the unit specific practices. So maybe you do a medication round once in a shift and then you go and do another round, or you just do one medication round and do the rounds only when the call bell rings. So it varies from hospital to hospital. And it is task oriented. It emphasizes on completing specific tasks like giving the medication or doing a bedsore care and things like that. So this is the traditional way of doing rounds. Whereas purposeful round is a systematic. It is structured and evidence-based, as I told you. We look at the structure in a short while. It is proactive. It is you anticipate and address patient needs even before they ring the call bell. Regular and consistent. It is scheduled checks. It is done ideally every hour, 24 by 7. So it is done all through the day. In all the 2 or 3 shifts which are doing, every hour there is a rounding happening on the patient. And this is focusing on holistic patient care, not just task oriented. And it looks at the 4 P's. What the 4 P's are, we look at in a short while. So that is purposeful rounding. Now, what are the best practices of purposeful rounding? It is to use a structured approach using checklists. So it's not just you just go and do the rounds. You need to use a checklist. You will engage with the patients. So there are again scripted communication. Now, where the nurses use these phrases to engage the patient. So that is also one of the special features of purposeful rounding. Focus on the 4 P's. We'll look into that in detail. Documenting the findings and collaborating with team members. Suppose you are not able to do purposeful rounding because you had an emergency or a new admission, then you will collaborate with your team members and ask them to do that rounds, every hour rounds for your patients also. So there is cross covering of the nurses in the floor to make sure the purposeful rounding happens every hour. And you need to do audit and evaluate your purposeful rounding practices and adjust the practices as you go along. So these are all the features. So I'm going to sort of dive deep into each one of them. So let's look at structured approach to the rounding in purposeful rounding using checklists. So what do you mean by structured approach? So whenever you do rounds, you look at all these things: vital check, pain assessment, medication review, mobility and fall risk assessment, skin integrity check, hydration and nutrition status. You would probably do it most of the time, but here you will use a checklist to make sure it is done every time you visit the patient. So here is an example of a checklist. So vital signs, you tick that, and if you write it down, the pain assessment, where is the pain and what is the pain management, medication review, administered, any side effects, mobility and fall risk, skin integrity, hydration, and nutrition. So all these are entered in a systematic and formatted manner. So that is the systematic and approach to rounding. That's number one. The second is engaging with patients. So what is this scripted communication? Is that every time you go to the patient, there may be different ways of asking. So these are again only guidelines. It's not that you have to follow only these types of conversation. So it's just to start the conversation. How are you feeling today? Is there anything you need right now? Do you have any concerns or questions about your care? Are you comfortable? Do you need repositioning? Can I get you anything to make you more comfortable? So these are questions which you have to ask and engage the patient. So as I told you, there is no one set way of asking the questions, and it's not written in stone that you have to ask only these questions. So these are some examples, and you could vary it depending upon the time of the day, the type of the patient, and what you want to interact with. So using structured approach is the first thing. Engaging with the patient is the second. The third is focusing on this 4 Ps. I've been telling this 4 Ps. Now, what is this 4 Ps? So pain is the first one. So you need to ask the patient, do they have any pain, or already the pain is there? You ask, how is your pain? Position, you'd ask, are you comfortable? Do you need any repositioning? Because you see, most of the time the patients will call you because of these things, right? And the third is personal needs. Do you need any assistance? No, of going to the toilet, for example, or anything else. So, or make a phone call to a relative. So any assistance, you ask for. Proximity of positions. Keep all the patient's positions and call bell within easy reach. Positions meaning maybe the spectacles, hearing aid, or maybe the magazine they are reading, whatever it is. So all these 4 Ps will make sure that the patient doesn't reach out for the call bell again, because you already taken care of the patient's pain, you've taken care of the position, any personal needs you have addressed, and you kept all the things which they require close to them. So this is why the 4 Ps work. And it will first of all reassure the patient that you're coming on a regular basis and asking for the well-being rather than they calling you, improving the patient satisfaction, and reduce the frequency of patient calls for non-nursing tasks. So that is the whole purpose of this purposeful rounding. The pun is intended. Now, for doing this, you will anticipate the patient's non-nursing needs, reduce the frequency of call bell use, improve patient satisfaction, and also improve patient safety. Because of all this, the fall risk and all this goes down, the pressure ulcer risk goes down, because you're repositioning frequently, you are making sure that the call bell is within reach. So this is again a checklist: pain, position, personal needs, positions. Okay, all these things you go through a checklist and make sure it is done. Now, structured approach, engaging with the patient, focusing on the 4 Ps is over. Now you have to document the findings. So there is some best practice in this also. Using the electronic health records for real-time updates is very, very important, and it is available in most hospitals. And you should note any change in the patient's condition. No need to write a detailed nursing notes every time you do the purposeful rounding. If at all there is any change in the patient condition, you will note that. But you need to record any vital signs which you have recorded or any intervention which you have performed and the patient's response for that. The fifth one is the collaboration with the team members. I already told you that you have to share the findings during the shift handing over, communicate with doctors, physiotherapists, and other healthcare members about any concerns, and participate in multidisciplinary meeting. And more importantly, as I told you, you can collaborate with their own nursing members to make sure that the purposeful rounding is not missed. So the last one is evaluating and adjusting. You've got to keep regularly reviewing the patient outcomes and feedback of the patient rounding. If you see in the literature, there are several articles looking at how satisfied the patients are. And most of the time, it is above 80 to 90%. When no, the purposeful rounding is properly implemented in your hospital, the patient satisfaction just goes up. And if it is coming down, then the rounding process will need to be adjusted. And you need to also implement quality improvement initiatives to keep on improving the rounding process. So what are the barriers to purposeful rounding? Why doesn't it happen? Many times, we talk about it in the meetings, but in implementation, it doesn't happen. Most of the time, it is changing the habit. The nurses are used to traditional rounds. So when you implement purposeful rounding for the first time, there is a lot of resistance. People think it's a lot of work, but actually it reduces the work because you are preempting many things, and the unexpected calls will not happen. So the major barrier is patient is sleeping. Do I still go and do all this for the patient? We will discuss that in the next slide. Then lack of acuity system for nursing assignment. So, the acuity-based nursing is very important. If you're not implementing, then the nurses are running hither and thither, and it's not very organized. It's because the senior most nurse and junior most nurse get almost equal number of acute patients. So the junior nurses are struggling. So that so that they don't have time to do purposeful rounding. Emergencies, sudden emergencies, a crash which happens, or CPR which you have to do, obviously will throw the purposeful rounding out of gear. As I told you, this is something which you have to tell your colleagues to take over. Lack of communication and teamwork, very important contradiction in policies. So in one hospital, there was a policy of not to disturb the patient in the night. And then they implemented the purposeful rounding where they said they have to round 24/7. Now, there is a contradiction in policy. So do you wake up the patient? Or because one policy says do not wake up when the patient is sleeping. Another policy says you got to do regular rounds in the night also. So make sure when you are implementing any new methodology or any new improvement practices, look at the existing policies and see that they are not in contradiction with each other. Now, is purposeful rounding done all 24 hours? This is a common question which is asked. The answer is yes. It is done 24/7, not just during waking hours. Then it is not purposeful rounding. But the difference is the frequency and what you focus on in the night is totally different. So you may not do it every hour. You may do it every 2 hours. But what you will focus is more on patient safety. Make sure that they don't fall. Make sure that comfort is there so that they are sleeping undisturbed. Okay? And do not disturb their rest unnecessarily unless it is required. So you need to train your nurses and tell them the priorities are different between the day and night, but still you've got to go and do the rounds and see the patient as it is scheduled. So that is important to remember. Now, the benefits of purposeful rounding is, as I told you, it is more effective, meaning that patient outcomes are better, efficient because you don't get unnecessary calls and you don't keep visiting the patient without planning. Improves the quality of care. Now, several papers are supporting this. Decreases patient anxiety. The fact that nurses are coming and visiting them regularly brings down the anxiety of the patient and the relatives. Improves communication and builds trust because you keep communicating, you use a structured approach and keep on asking the patient again and again. It improves trust. Decreases readmission rates because you frequent rounding, you detect things which you would not have detected in traditional rounding, address it, therefore readmission is less. And more important, is many of you will be interested, is reducing the call button usage. Now, about a couple of minutes we'll spend on call buttons. So we all want to reduce call button requests. Now, the reason for this is almost 70% are non-nursing requests, 50 to 60% are requests for toileting and housekeeping assistance. 10% for food and beverage. Only 30% are for medical reasons. This is, almost uniform. Wherever you do this study, this is where it will come. But when if you, do the purposeful rounding, if you implement, as you can see here, the medical calls come down by 15%. Housekeeping calls are more, but you address it in the your purposeful rounding and call the housekeeping even before the patient calls you by ringing the call bell. Food and beverage calls are also little bit more, but it doesn't really disturb you. Okay, so pre-study, the medical calls actually go down. That is the important thing to note, because then you are actually increasing the patient's safety. That's very important to note. So even though the other calls will, actually looks like it's going up, it is going to the appropriate person and not to the nurses. Now, what are the reasons for patient dissatisfaction when you don't answer the call well? Mainly because delay in response, they're waiting for a long time, and sometimes the call bell, they ring and it is ignored because all of either one of the nurses doing medication round, the other nurse is doing admitting a patient, the other one is actually in a rounds with the doctor. So there's nobody in the nursing desk, so it gets ignored. So these are the reasons for patients dissatisfaction. So a lot of money is being spent on technology. So you can see this very high-tech call bell things where it gives visual thing to the patient to press for different things, for anti-fall, anti-pressure, and then you get very detailed statistics, how often the patient called and all that. So basically, spending money on technology gives very little result. Instead of that, purposeful rounding actually reduces call bell requests by a very good percentage. So it's very, very important to anticipate patient needs by implementing purposeful rounding, and that will in turn reduce the call bell requests. So this is again, just emphasizing that you have to do it at regular intervals. You can't call purposeful rounding and do it erratic. It has to be scheduled and it has to be done at regular intervals. So after all, the aim is not to reduce call bell requests. No, if the call bell is not ringing, that means the patient is safe. But it should not be the other way. If the patient will be safe if you are visiting them frequently. So that is the whole logic behind purposeful rounding. So I did take a long time to cover this, but I thought it's very important to understand the basis which purposeful rounding is done and the various components which are involved in purposeful rounding which you have to take care. Just labeling it like purposeful rounding and doing just for the sake of doing it will not make any difference. So we'll get into the next part of the strategy, which I told you, 3 strategies we'll discuss. The next, which will help the effectiveness of nursing rounds. So the second one is using a whiteboard in the patient room. So what is a whiteboard? It's like any the normal whiteboard, but it is the certain things are printed in the whiteboard and it is formatted, not just keeping a blank whiteboard. It is placed in the patient room. And this provides a consistent and very visible or visual means of conveying important information to everyone. So when the doctor comes on rounds or the physiotherapist comes on rounds, housekeeping, onto the patient and the relatives, it is very transparent and everybody knows what is going to happen. So here is an example of a whiteboard. I'm just giving an example. So you'll write the unit name here and all the usual demographic stuff will come here. The day of the week and the phone number which the patient should contact, what is today's date, and how the patient wants to be called, and the target discharge date. Very, very important. Especially patients like long-term patients and also patients who have undergone surgery. I always do it. After surgery, especially complex surgery, they've been in hospital for 4, 5 or 6 days or even weeks. They get dependent on the hospital. So it's always give a target. I'm going to send you home on this day. So very, very important. So anybody who comes to the room, all this information is very very useful. So then you also can see that ability of the patient to perform ADL is there. So anyone who comes to the room will know whether they are independent or whether they need assistance or full assistance. And what are the assistive devices they use? You can circle them. And then the next is the diet and fluid intake. As no assistance with mobility is there, diet restrictions, if any, and how much of fluid is allowed in 24 hours. Everything is written there. And what is the risk? What is the fault risk assessment? Is high, medium, or low? And what is the tissue injury risk? And any injury to the bone or any coagulation issues? And if the patient is a post-op patient, everything is there. And the My Home team is actually the patient's relatives whom to contact, because otherwise we'll be running around looking into the case sheet. Waste a lot of time. And you want to call the patient relatives. All these numbers are there in the whiteboard itself. Then you come to the nursing care plan. What are the today's goals in terms of activity, diet, pain management, and what are the learnings from yesterday which you want to educate the patient? And what are the procedures need to be done for that particular day? Do they need to go for an X-ray or MRI? All those things are there. And the patient and the relatives know who the nurse is, who the nursing assistant is, any other provider's name, and who's the administrative or complaints phone number. All those things you can write it here so that they can immediately do it. Pain scale is there so that anybody walking into the room will know what is the last addressed level of pain and how effective the pain management is. Then you look at so these are the details of healthcare workers pain assessment. Then the discharge goals. So what activity you want the patient to do before discharge? What is the diet they should be eating? How should the pain management be? What are the patient education you're going to give at the time of discharge? And where is the patient's home and how are they going to be transported? And there is a small notes so where you or the patient can keep writing to remind anything important so that it's not missed. It's such a very important tool. It is very unfortunate that it is not used that well, and it helps a lot in not only doing the rounds but in the holistic care of the patient. So this is the concept of whiteboard. And so how does it help? It enhances communication between the patient and care team. You can imagine how nicely it will enhance the communication. Bridges language barriers. Even if the patient does not talk your language, you can see most of the things are in visual means. So it bridges language barriers. It serves visual reminders about so many things and increases patient engagement. The patient gets more engaged looking at it, and gets more engaged in the treatment and improves the continuity of care, because between shifts, looking at patient will get, the caregivers or the healthcare team will get used to looking at the whiteboard rather than calling and asking the patient. So it needs to be updated on a regular basis, at least every shift, to make sure that it is current. So that's about whiteboards. And finally, we'll talk about the 5 bedside safety check, which is the third strategy that will improve the safety when you're doing rounds. So when is it done is very important. Whenever you are handing over, when you go to the patient along with your person who's relieving you, you need to do this. And also when you're doing rounds and leaving the patient's room, you got to do this 5 essential safety checks. Now, if you look at it, why is that we have to do? Most of the problems related to safety happens because, one, the IV can stop and there'll be interruption in IV therapy. Or the allergy in ID band is not looked at or is not present. And so identification and medication errors happen. Bed height is not the lowest. It is not locked. The railings are not put. So there is a risk of patient falls. And finally, the call bell, if it is not within easy reach, the communication errors can happen, and there is also risk of falls because patient stretches out to reach for the call bell. So you can see these errors again will almost 80 to 90% of the errors happen because of these simple things: medication errors, identification errors, fall, and patient communication errors. So by doing this 5 essential safety checks, you will actually minimize 80% of errors. Very, very important. So what are these 5? 3 on the hand and 2 on the bed. It's easy to remember. So one is the IV site, which is on the patient hand, and the IV fluids. Is it correct? Is it flowing? The second is the allergy band, again on the patient's hand. Is it in place? The allergy band and the ID band. And third, the bed railings, are they up? Is the bed height lowest? And is the call button within reach? So sorry, I told it the other way. It is 2 in the hand and 3 on the bed. Okay, 2 on the hand is the IV site and the IV fluids and the allergy band, allergy and ID band. 3 on the bed is the height of the bed, the wheels locked, the call bell within in on the bed, and the bed rails are up. So if you do these 3, 5, all those errors which we spoke in the previous slide will be almost eliminated. So this is the value of the 5 minimum safety checks in all clinical settings. It doesn't matter which ward you work or which department you work, you got to implement this. So, ladies and gentlemen, in summary, we talked about 3 strategies to increase the effectiveness of rounds. One is purposeful rounding, which is proactive. It is scheduled, focusing on the 4 Ps and other things which we discussed. Whiteboard is a visual reminder which conveys important information and improves continuity of care. The 5 minimum bedside safety checks will check, all the errors which can happen, and also whether the treatments are administered, especially the IV fluids are administered properly. Okay, thank you so much. I think again, all of you are here till the end of the session. That's very, very nice to see. And thank you.